In the field of kidney health, there has been a paradigm shift that challenges the idea that kidney disease inevitably worsens over time and cannot be stopped. Recent scientific studies, which spanned 8 years and involved more than 400 patients suffering from kidney problems, reveal promising possibilities. Contrary to the belief that kidney health deteriorates irreversibly, even individuals in the late stages of kidney disease, such as the 4th and 5th stages, can see improvement by adopting specific measures. In this video, we dive into 5 critical steps that empower individuals to take control of their kidney health and provide actionable insights and tips for a holistic approach. So without any further delay, let's begin. Step 1. Managing oxalates for kidney health. While consuming a diet rich in fruits and vegetables is generally beneficial for kidney health, it's important to be mindful of the presence of oxalates in certain foods. Oxalates are natural compounds found in many plant-based foods, including spinach, nuts, and chocolate. When consumed in excess or by individuals who are susceptible, oxalates can aggregate and form crystals in the kidneys, potentially leading to the formation of kidney stones. However, it's crucial to maintain a balanced approach. Calcium-rich foods can play a significant role in managing oxalate levels. Calcium binds with oxalates in the gastrointestinal tract, forming insoluble calcium oxalate, which can then be excreted through the digestive system. Incorporating calcium-rich options such as low-fat dairy products, tofu, or fortified plant-based milk can help bind oxalates and facilitate their passage through the kidneys, reducing the risk of stone formation. Another strategy to consider is boiling vegetables. Boiling certain vegetables, like spinach, can help lower their oxalate content. This is because oxalates have the tendency to leach into the cooking water during the boiling process. However, it's important to note that boiling vegetables may result in some nutrient loss. To retain some of the nutrients that have leached out, consuming the cooking water as part of a soup or broth can be a good option. Including an adequate amount of dietary fiber, primarily sourced from fruits and vegetables, is also beneficial for managing oxalate levels. Fiber binds to oxalates in the intestines, preventing their absorption into the bloodstream. This helps maintain optimal oxalate levels in the bloodstream, reducing the chances of crystal formation in the kidneys. Additionally, consuming fiber-rich foods promotes regular bowel movements and supports overall digestive health. It's important to note that individual tolerance to oxalates can vary. Factors such as genetics, underlying health conditions, or a history of kidney stones can influence susceptibility to stone formation. If you have a history of kidney stones or other kidney-related conditions, it is advisable to consult with a healthcare professional or a registered dietitian who can provide personalized dietary recommendations based on your specific needs. By being mindful of your diet, you can enjoy the benefits of a plant-rich eating pattern while minimizing the potential risks associated with oxalates. Most importantly, you're still here with us and may have overlooked subscribing. If you find this video beneficial and recognize the effort being put into it, we would appreciate seeing your opinion in the comments. Don't forget to subscribe to our channel and feel free to return to continue engaging with us. Step 2. Utilizing fiber to combat uremic toxins. Uremic toxins are harmful substances that accumulate in the blood when the kidneys are unable to effectively filter them out. These toxins pose a significant threat to kidney health and can contribute to the progression of kidney disease. However, incorporating soluble fiber into the diet can play a vital role in combating these uremic toxins. Soluble fiber, such as acacia fiber derived from the sap of the Acacia senegal tree, has been found to have beneficial effects in binding with water to form a gel-like substance in the gut. This gel-like substance can effectively bind to uremic toxins, preventing their absorption into the bloodstream. By reducing the absorption of these toxins, soluble fiber helps to alleviate the burden on the kidneys and promotes overall kidney health. Studies have suggested that acacia fiber, specifically, may have a significant impact on kidney health. Research has shown that acacia fiber supplementation may contribute to avoiding dialysis for up to 8 years in individuals with serious kidney problems. This indicates the potential of acacia fiber to delay the need for more invasive treatments and provide support for kidney function. Incorporating fiber-rich foods into the diet, including sources of soluble fiber like acacia fiber, can have broader benefits beyond combating uremic toxins. Fiber promotes regular bowel movements, prevents constipation, and supports overall digestive health. It also helps regulate blood sugar levels, lower cholesterol levels, and maintain a healthy weight. These additional benefits contribute to the overall well-being of individuals with kidney disease. It's important to note that while acacia fiber has shown promising results in studies, it should be used under the guidance of a healthcare professional or a registered dietitian. They can provide personalized recommendations based on individual needs and help ensure the appropriate dosage and usage of acacia fiber for optimal kidney health. Step 3. Enhancing vitamin D intake. Vitamin D deficiency is highly prevalent in individuals with kidney issues, affecting approximately 80% of this population. Adequate levels of vitamin D are crucial for various aspects of health, including regulating blood pressure, supporting bone health, and even lowering creatinine levels. To determine vitamin D status, healthcare professionals often use the 25-hydroxy-vitamin D test. A level below 30 nanograms per milliliter indicates a deficiency. If a deficiency is detected, it's important to take steps to enhance vitamin D intake and address the deficiency. Incorporating approximately 2,000 international units, IU, of vitamin D daily can be beneficial for individuals with kidney issues. This can be achieved through a combination of dietary sources and supplements. Foods such as fatty fish, example, salmon, mackerel, fortified dairy products, and egg yolks are natural sources of vitamin D. However, it can be challenging to obtain sufficient vitamin D from diet alone, especially for those with restricted diets or limited sun exposure. Supplementation may be necessary to achieve adequate vitamin D levels. Along with vitamin D supplementation, it is advisable to consider the co-administration of vitamin K2 and magnesium. Vitamin K2 helps ensure that calcium is properly utilized in the body, directing it towards the bones and teeth rather than accumulating in the arteries or soft tissues. Magnesium, on the other hand, plays a vital role in vitamin D metabolism and activation. For individuals with more severe kidney issues, specialized vitamin D supplements may be prescribed. These supplements are formulated to meet the specific needs of individuals with impaired kidney function and can help optimize vitamin D levels while considering the limitations and requirements of kidney health. It's important to note that vitamin D supplementation should be done under the guidance of a healthcare professional or a registered dietitian. They can assess your specific needs, monitor your vitamin D levels over time, and recommend the appropriate dosage and duration of supplementation based on your kidney function and individual circumstances. By enhancing vitamin D intake, individuals can support various aspects of their health and well-being. Step 4. Addressing diabetes as a common culprit. Diabetes is a significant contributor to kidney disease, affecting nearly half of individuals with kidney issues. While it is often believed that prolonged type 2 diabetes is irreversible, recent studies have shown that it is possible to reverse the condition, even after 11 years. Dietary modifications play a crucial role in managing and potentially reversing diabetes. One dietary strategy that has shown promise in combating diabetes is the inclusion of apple cider vinegar, ACV. ACV has been the focus of research due to its potential benefits in managing blood sugar levels and improving insulin response, which are key factors in preventing kidney damage associated with diabetes. Regular consumption of diluted ACV before meals has been found to have positive effects on blood sugar control. ACV contains acetic acid, which is believed to slow down the digestion of carbohydrates and prevent spikes in blood sugar levels after meals. This can help individuals with diabetes maintain more stable blood sugar levels throughout the day and reduce the risk of kidney damage associated with high blood sugar. In addition to its potential impact on blood sugar control, ACV may also improve insulin sensitivity. Insulin is a hormone that helps regulate blood sugar levels, and insulin resistance is a characteristic feature of type 2 diabetes. By enhancing insulin sensitivity, ACV may improve the body's ability to utilize insulin effectively, leading to better blood sugar control and potentially reducing the risk of kidney complications. It's important to note that while ACV shows promise in managing diabetes, it should be used as part of an overall diabetes management plan, which may include other lifestyle modifications, medication, and regular monitoring of blood sugar levels. Consulting with a healthcare professional or a registered dietitian is crucial for personalized guidance on incorporating ACV into a diabetes management plan and monitoring its effects. By addressing diabetes, individuals can take proactive steps towards protecting their kidney health and overall well-being. Step 5. Implementing dietary changes for kidney recovery. In addition to the previous steps outlined, implementing simple dietary changes can have a significant impact on kidney recovery. These adjustments can help manage blood pressure, reduce fluid retention, alleviate strain on the kidneys, and promote overall kidney health. Limiting sodium intake is crucial for individuals with kidney issues. Sodium can contribute to high blood pressure and fluid retention, placing additional strain on the kidneys. Processed and packaged foods are often high in sodium and should be avoided. Instead, opting for fresh, whole foods and cooking meals at home using herbs and spices for flavoring can help reduce sodium intake. Protein intake may need adjustment depending on the stage of kidney disease. In some cases, reducing protein intake can help lighten the workload on the kidneys. This can be achieved by moderating the consumption of animal-based protein sources, such as meat, poultry, and dairy products. Plant-based protein sources, like legumes, tofu, and quinoa, can be incorporated as alternatives. Potassium-rich foods can be beneficial for individuals with healthy kidneys, as potassium plays a role in maintaining proper fluid balance and muscle function. However, in advanced kidney disease, the kidneys may struggle to regulate potassium levels. In these cases, moderation in potassium-rich foods, such as bananas, oranges, and tomatoes, may be necessary. Consulting with a healthcare professional or a registered dietitian can provide guidance on appropriate potassium intake based on individual needs. Opting for complex carbohydrates, such as whole grains, fruits, and vegetables, is recommended for kidney health. These carbohydrates provide important nutrients, fiber, and antioxidants while promoting stable blood sugar levels. Conversely, refined carbohydrates, such as white bread, sugary snacks, and processed foods, should be limited as they can contribute to blood sugar spikes and inflammation. Limiting alcohol consumption is essential for kidney health. Excessive alcohol consumption can lead to dehydration, high blood pressure, and liver damage, which can further impact kidney function. It is advisable to follow recommended guidelines for moderate alcohol consumption or, in some cases, consult with a healthcare professional to determine if alcohol should be avoided altogether. Effectively managing diabetes, if present, is crucial for kidney health. Consistently monitoring blood sugar levels, taking medication as prescribed, and following a diabetes-friendly diet can help prevent further kidney damage. The steps outlined in Step 4, such as incorporating apple cider vinegar and making dietary modifications, can assist in managing blood sugar levels and supporting overall diabetes management. Staying hydrated is vital for kidney health. Drinking an adequate amount of water throughout the day helps maintain proper kidney function and prevents dehydration. The specific fluid intake recommendations may vary depending on individual needs and medical conditions, so it's beneficial to consult with a healthcare professional for personalized guidance. These dietary adjustments, combined with the previous steps, can support kidney recovery and help individuals take proactive measures to protect their kidneys and promote overall well-being. Taking charge of kidney health involves a holistic approach encompassing dietary choices, vitamin supplementation, and lifestyle modifications. The evolving understanding of kidney diseases challenges the fatalistic perspective, offering hope for improvement even in advanced stages. By incorporating these comprehensive steps into daily life, individuals can actively contribute to the well-being of their kidneys, fostering a healthier and more resilient renal system. If you are already a kidney patient, ask your healthcare expert about how much water you should drink at least. Thank you to watch and subscribe channel. See you in the next video.